Okay. What is the most likely diagnosis? A 60-year-old man with a history of diabetes presents to the emergency department with a 2-day history of right upper quadrant pain, abdominal pain, fever, and jaundice. Lab tests reveal an elevated white blood cell count, elevated bilirubin, and abnormal liver function tests. An ultrasound of the abdomen shows gallstones, dilated common bile duct, and pericholecytic fluid. What is the most likely diagnosis? Okay, so we have gallstones, we have a dilated common bile duct, and pericholecytic fluid. We also have a white blood cell count that's high, elevated bilirubin. So to me, it's like an issue with the gallstone causing dilation and no flow of bile is being getting out. So there is now an issue with just with like now he has jaundice because of it and abnormal um and pain. That's also because the gallbladder is contracting against this gallstone. So okay. My initial guess would be between ascending cholangitis and choledocholithiasis.
Okay.
Um, I actually don't. I'm leaning towards ascending cholangitis just because of white blood cell count is high, and there's like a obviously if you don't have like a constant flow of bile, it can like allow bacteria come invade in that. Choledocholithiasis, I mean that is literally like bile duct gallstones. So I don't know why that would be wrong in my opinion, but I would go with this.
Good. Okay, let's talk about that. Okay, so you're 100% right. Choledocholithiasis isn't necessarily wrong, right? It just means a stone within the main common bile duct, right? But usually when they say choledocholithiasis, meaning you find a stone, but you have no symptoms. Does it make sense what I'm saying? So you have
Yeah,
a
so there would be no
stone.
jaundice, no upper.
Exactly,
Okay.
exactly. So this is kind of one of those questions that, D is not incorrect, right? It's not wrong. Just B is a way better answer. Ascending cholangitis is actually the infected portion where if you have a stone in the main common bile duct, which then backs up and causes stasis in the bile, meaning bacteria is able to ascend, right? Meaning
Mhm.
go up, right? Meaning that your gallbladder as well as your liver are going to take a hit because of infection. So definitely for sure you're gonna have jaundice, right? You're gonna have tenderness, right? You're gonna have fever, right? Elevated white blood cell count, right? And so all of those are going to kind of fit your definition or your criteria for ascending cholangitis. And I just want to make sure here what is okay, so here it is. Symptoms of acute cholangitis, including fever, jaundice, and right upper quadrant pain. That's called a Charcot's triad.
Mhm.
Okay, so make sure you remember that. Also for step 2 is super important. So good.
Cool.